Hello student, today I will tell you about joints. So joints or articulation. Articulation. So joints or articulation is the region of the skeleton where more than two bones or cartilage meets and articulate. Means we can simply say that it is a junction between more than two bones or cartilage. So what is the function of the joint? The main function or prime function of the joint is to facilitate growth and transmit force of one bone to other. Means it is a device to permit movement in our body. In case of long bone, the end is articulate or articular in nature. In case of flat bone, margin are articular, and in case of short or irregular bone, the surface is articular. Okay. So the next topic of the joint is classification. Classification of joints. Okay. First is structural classification. Structural classification. On this basis, the joints is classified into three categories. First is fibrous joint. Fibrous joint. Second is cartilaginous joint. Cartilaginous joint. And the third is synovial joint. Synovial joint. Again, fibrous joint is of three types. First is sutures. Second is syndesmosis. And third is gomphosis. Okay. Again, cartilaginous joint is also two types. Primary cartilaginous joint and secondary cartilaginous joint. And synovial joint is also of different type. First is ball and socket type. Ball and socket. Second is hinge type. Hinge joint. Third is pivot joint. Pivot joint. Fourth is condylar joint. Fifth is plane joint. Sixth is ellipsoid. And seventh is saddle variety or saddle joint. Saddle joint. So this is the structural classification of the joint, and this is the most common classification which is followed, and इसी के बारे में हम पूरा डिटेल में पढ़ेंगे. The next classification is functional classification. Functional classification. On this basis, the joints is classified in three categories. First is synarthrosis. Synarthrosis. Second is amphiarthrosis. And third is diarthrosis. Diarthrosis. Okay, this is the functional classification. The third classification is regional classification. Regional classification. Regional classification. On this basis, again, joints is divided into three categories. First is skull type. Second is vertebral type, and third is limb type. This is the regional classification, and the fourth classification is on the basis of number of articulating bone. On this basis, again, joints is divided into three categories. One is simple joint. It means when two bones articulate, then it is called simple joint. For example, phalangeal joint, interphalangeal joint. Simple joint. Next is compound joint. It means when more than two bones articulate, then it is called compound joint. For example is elbow joint or wrist joint. And third is complex joint. Complex joint means when the joint cavity is divided by a articular disc. If we draw the diagram, then this is one bone and this is another bone. This is fibrous capsule and this is joint cavity. When this joint cavity is divided by a articular disc, okay, then it is called complex joint. And the example of the complex joint is temporomandibular joint, or second is sternoclavicular joint. Okay, so this is the classification of the joint. Now let us talk about fibrous joint. Okay, in fibrous joint, the bones are joined by a fibrous tissue. Bones are joined by fibrous tissue. Okay, suppose this is one bone and this is another bone. और ये जो दो बोन होती है एक दूसरे से कैसे कनेक्टेड होंगी? With the help of fibrous tissue. This is the fibrous tissue. Okay. The next point of fibrous joint is it is immovable joint, or it provide in certain condition it produce some slight degree of movement. और ये जो small movement हमें fibrous joint में देखने को मिलती है, ये during childbirth देखने को मिलती है. When the baby passes through the vaginal canal, the joint between the skull show some degree of or show some slight movement through which the baby can pass easily through the vaginal canal. Okay, so this is immovable joint. Or produce slight degree of movement. Okay, The fibrous joint may be of three types. May be of three types. First is suture, second is syndesmosis, and third is gomphosis. ओके, अब एक एक करके बात करते हैं. फर्स्ट इज suture. ये जो suture होते हैं, और वी कैन से दैट जो sutural joint होते हैं, ये जो इट इज प्रेजेंट इन द skull bone, or we can say that it is the characteristic feature of the skull bone, present in skull bone. Okay, if we talk about the structure of the sutural joint, the margin of the bone is covered with osteogenic layer. This osteogenic layer is also known as cambial layer. Okay, and this cambial layer is further covered by a fibrous capsule. This is not a true capsule, जो कि हमें synovial joint में देखने को मिलता है, but it looks like a capsule, and it is formed by the continuation of the periosteum and endosteum. This is fibrous capsule. This is periosteum, and this is endosteum. अब ये जो स्पेस होता है बिटवीन टू बोन, दिस स्पेस इज फिल्ड विथ fibrous connective tissue. This space is filled with fibrous connective tissue. Okay. अब क्या होता है, जैसे जैसे एज बढ़ती है, ये जो स्पेस होता है वो कम होता जाता है, और ये जो कैम्बियल लेयर होती है और ऑस्टियोजेनिक लेयर होती है एक दूसरे के अपोज हो जाती है. देन आफ्टर सम टाइम दिस कैम्बियल लेयर बिकम्स सिनोस्टोसिस, मतलब ये जो ऑस्टियोजेनिक लेयर होती है बोन्स में कन्वर्ट हो जाती है, एंड द suture is obliterated. Okay, so this is the structure of the sutural joint. Now next is types of suture. So on the basis of the shape of the margin of the bone, the suture may be of different type. Okay, on the basis of margin, on the basis of shape of the margin, of bone, the suture may be of different type. Okay, so first is plain suture. Okay, in plain suture the margin of the bone is plain. कुछ ऐसा दिखेगा, plain होता है. Okay, then it is called plain suture, and the example of plain suture is internasal suture. Next is interpalatine suture. Okay, this is the plain suture. Next is serrate type. In serrate type, the margin of the bone is short tooth like. Okay, जैसे वो पेड़ काटने की आरी होती है, उसका जो शेप होता है, कुछ अगर बोन की मार्जिन ऐसी होती, कुछ उस तरह की होती है, देन इट इज कॉल्ड सिरेट टाइप। कुछ ऐसा होता है मार्जिन इसका। Then it is called serrate type. And the example of serrate type suture is sagittal suture. Sagittal suture. Now the third is denticulate type. Denticulate type. If the margin of the bone is tooth-like, then it is called denticulate suture. Okay. And the example of denticulate suture is lambdoid suture. Lambdoid suture. Okay. If the margin is tooth-like. Now the fourth is squamous suture. Squamous suture. In squamous suture, the margin of one bone is overlapped to another. Then it is called squamous suture. And the example of squamous suture is squamoparietal suture. मतलब parietal bone and squamous part of the temporal bone, then it's called, and it is the example of squamous suture. Next suture is shin dialysis. Shin dialysis. In shin dialysis, the edge of one bone is fit into the groove of another bone. Okay. This is the edge of one bone which is fit into the groove of another bone, and this is joined by a fibrous tissue. And the example of shin dialysis is rostrum of sphenoid and upper margin of vomer. Okay. This is the example of shin dialysis. So it's all about suture. Now the next type of fibrous joint is syndesmosis. Second is syndesmosis. Syndesmosis. In this type of fibrous joint, the surface of the bones are connected by a interosseous ligament. Means bones are connected by interosseous ligament. Okay. Suppose this is one bone and this is another bone, and these two bones are joined by a interosseous ligament. This is the interosseous ligament. Interosseous ligament. And the example of the syndesmosis is inferior tibio-fibular joint. Another example of syndesmosis is interosseous ligament of forearm and leg. Okay, this is the example of syndesmosis. Now the third type of fibrous joint is gomphosis. Now the third is gomphosis. Gomphosis. It is also known as Paget's socket joint. Also known as also known as page and socket joint. And the example of the gum forces is joint between teeth and lower jaw jaw. यहाँ पे क्या होता है, जो रूट ऑफ द टीथ होता है इट इज फिट इनटू द सॉकेट ऑफ द लोअर जॉ. अगर मैं डायग्राम ड्रॉ करूं तो कुछ ऐसा बनेगा. Okay, this is the root of teeth and this is the socket of lower jaw. And these two structures are joined by a fibrous tissue. Okay, and this is called gum forces. Now it's all about fibrous joint. Now the next is cartilaginous joint. Okay. In cartilaginous joint, the bones are joined by a cartilage. Bone are joined by cartilage. Okay. Now this is one bone and this is another bone, and these two bones are joined by a cartilage. Okay, this is cartilage. The cartilaginous joint is of two types. It is of two types. First is primary cartilaginous joint, and the second is secondary cartilaginous joint. Okay. Now let us talk about primary cartilaginous joint. The primary cartilaginous joint is also known as synchondrosis. Synchondrosis or hyaline cartilage joint. Okay. In primary cartilaginous joint, the bones are joined by a plate of hyaline cartilage. Okay. Bones are joined by hyaline cartilage. Okay. It is immovable joint. It is immovable. The primary cartilaginous joint is temporary in nature because जो ये दो बोन्स के बीच में हाइलाइन कार्टिलेज प्रेजेंट होती है, ये हाइलाइन कार्टिलेज आफ्टर सर्टेन एज it converted into bone and the process is called synostosis. Okay, it is temporary in nature. Temporary in nature. Okay, and the example of the primary cartilaginous joint is joint between epiphysis and diaphysis of growing long bone. Okay, Suppose this is epiphysis and this is diaphysis, and these epiphysis and diaphysis are joined by a epiphyseal plate, and this epiphyseal plate is made up of hyaline cartilage. Hyaline cartilage. Okay. Next example of primary cartilaginous joint is spheno-occipital joint. Next example is first chondro-sternal joint. Next example is costochondral joint. Costochondral joint. Next example is Jiffy-sternal joint. Jiffy-sternal joint. So all these are the example of primary cartilaginous joint. Now the next is secondary cartilaginous joint. Secondary cartilaginous joint. Okay. In secondary cartilaginous joint, the articular surface of the bone is covered with hyaline cartilage, and these two bones are joined by a plate of fibrocartilage. Okay. If you draw the diagram, the margin of the bone is covered with hyaline cartilage. Okay, this is the hyaline cartilage, and these two bones are united by a plate of fibrocartilage. This is the fibrocartilage. Okay, this is fibrocartilage, and this is hyaline cartilage. Okay. The secondary cartilaginous joint is permanent in nature and present throughout the life. Okay, and the example of secondary cartilaginous joint is joint between vertebra. Joint between vertebra. Next example is pubic symphysis. Pubic symphysis. Next example is manubreo-sternal joint. Means joint between manubrium and body of sternum. ये जो secondary cartilaginous joint होते हैं, it is present in the median plane. The secondary cartilaginous joint present in median plane. And the exception is symphysis menti. मतलब joint between two half of the mandible. Okay, अब ये exception क्यों होता है? Because ये जो joint होता है median plane में present होता है and these two half of the mandible joined by a cartilaginous plate. But होता क्या है? After 1 year of postnatal life, this cartilaginous plate is converted into bone. That's why it is the exception of the secondary cartilaginous joint. Okay, so it's all about cartilaginous joint.